Hi, this is Pamela Baird with Healthcare Executive Search, founder. I'm so happy to be back here today. I have my very dear friend Andrew with us. We're going to talk about his incredible journey. This is our podcast, Back Leaders Reshaping Healthcare. And we're going to talk today a little bit about his journey. You're going to get some tips and inspiration on how he went up through the sales channels to be a great leader. And we're also going to talk about some other relevant healthcare topics here in healthcare. Andrew, thank you so much for joining me today. I really appreciate your time. And I know
Well,
the listeners do as well.
well, Pamela, I was excited when you extended me the opportunity, so it's great to be here today.
Wonderful. Well, why don't we just kind of start from the beginning, if you don't mind? Can you tell us a little bit about your career? I mean, you literally started in sales
I
lead,
did.
and worked your way on up into senior healthcare leadership. Just tell us a little bit about that and tell us a little bit about the journey and some of the maybe some tidbits, nuggets, learning nuggets for the listener about maybe their own career progression.
Sure. Healthcare, it was a complete accident that I got into it, to be honest with you. I got my first real healthcare sales job. Not so much that it was in the industry, but I needed a job at the time. And as I got into it and I got my feet underneath me, I realized that I was having success in talking with patients. I was having success talking to doctors, nurses, case managers, insurance companies, kind of all the radically different conversations all across the board, but all very patient centric. So that made me think and gave me the confidence to say, I can do this. And I started looking around for a different opportunity, which led me then to my proper first hospital job, which was at Mercy Medical Center in Canton, Ohio. Such a learning experience that was. I went in as their laboratory account manager, no background in laboratory, mind you, but what was told to me is that you can sell. We have all sorts of technical people here who can't, but they can be a source of information for you. So did that for about 6, 7 years at that point. And during that time, I wanted to get more on the leadership side and learn more about hospital operations. So conversations I was having, I was recommended go get your MBA. I did that, became a director, wanted to still get more of the operational uh, experience
Mhm.
under my belt because everything had been sales. So I took a leap of faith and asked my wife how she felt about maybe moving to Louisiana for a little while. And we did that. And that was truly my first real exposure to operations as a VP of business development. During my time there, again, wanting to continue to learn, that's where I made the choice to get my board certification in healthcare management, became a fellow of the American College of Healthcare Executives. It is a great test that if anyone's listening to this, I definitely recommend that you get that. It was very important to me because I'm not clinical. But again, it gives you such a well-rounded education to being a leader and exposes you to a lot of people within that network who are both fellows and not fellows for that matter, but just a lot of people who have very innovative, forward thinking ideas where that exposure has served me well, which then led me to serving as a CEO of a critical access hospital in Georgia. So that's the 30,000 foot view of my career, starting from sales and ended up as a CEO.
That's amazing how you just kind of continued and progressed and you looked for education, you look for resources, you look for opportunities to continue your growth and to serve. Any additional nuggets that you would tell the listener who might want to go into leadership?
Yeah, definitely be comfortable not being the smartest person in the room.
Mm.
That's something that I openly admit a lot of times when I'm working with cross functional teams. there can always be someone in that room who knows more than you, and that's great. Don't look at that as a threat. Look at it as a learning opportunity to make you better, but also help you execute your idea, especially if you're in a rural community. You want as many people working on a project as possible
Mhm.
to better serve the underserved communities that you're in. So again, don't look at it as a threat to you being a leader. Look at it as a way to enhance yourself as a leader.
Yeah, absolutely. This was gonna be a little bit later on question, but you led me right into it right now,
Okay.
if you don't mind. What would you wanna talk about? Rural healthcare has been very underserved, and we've been talking about it and talking about it. From someone who's been leading a rural healthcare organization, any other suggestions on how best to care for people in that situation?
And that's a great question, Pamela. And I'm not going to probably say anything that's going to surprise anyone. But one of the biggest things we can do in the rural healthcare space is it's access first and foremost. But I think whether it's rural healthcare or healthcare in general, but especially the rural uh, communities, to your point, we just have to do a better job on the prevention side. There are so many times where in a rural community, and I have seen this before, where somebody will come in to your emergency department because that is their primary care office, for lack of a better term. And by the time they come in, they're very, very sick. And there's been some instances where what one thought maybe it was a backache ended up being a very, very, very severe diagnosis, to the point where when that person finds out what it is that they're being seen for, what it turned out to be, they're in shock. So I think it's in general moving sick care to well care. And in rural communities, there needs to be more access, whether that is federally qualified health centers, whether it be rural healthcare communities, whether it be telemedicine, whether it be just getting to see the patients where they are
Mhm.
and giving them the resources that they need. And I think that is probably the most exact answer I can give you, so we don't spend the next hour just talking about this alone because we could.
Yes, we could, but I wanted to get your perspective and you led me right into the question, so thank you for just taking a second there. I wanna really go on too, because you've built teams even before the hospital. You've had to build sales teams, you've had to manage other teams. What do you feel, in your own opinion, makes such a great leader? And also, what are some tips maybe on hiring the right people?
So, hiring the right people. Let's start there because I think that's probably the most important thing. Because if you're doing your job as a leader to pick the right people, it makes your job so much easier. There were times where very early in my career, and it was really blind luck, to be honest with you. I had some really great hires, and when I had to go after having the interview and we did the debrief, and I would be talking to my one up and another hospital exec at that time. And we were going through the points that we really liked, and maybe there were some concerns. I hired more for personality and someone's willingness to learn. And that has always served me well. And we as leaders have the responsibility to be mentors, to teach, to
Mhm,
help develop, because as a leader, it's ultimately our job to create other leaders.
mhm,
So hiring the right person is definitely it. I would rather hire somebody who maybe doesn't have all the operational expertise, but really will be willing to learn and wants to work at it and wants to be challenged. And
Mhm.
in healthcare, I really think in the world that I reside in, which is non-clinical, I think that's a very big part of the puzzle that you have to have that in you, and that can't be taught, and that very rarely can be instilled. It's an ethic and a part of somebody's personality that you have to be able to pick up on. So that is probably how I got very lucky early in my career by saying, and I'll be brutal to myself, not realizing what I was doing was for the best, just, you know, came back and said, "Hey, I think this person who doesn't have a lick of sales experience would be a phenomenal account manager in the future I was given the opportunity to work with her, and the hospital was to invest in her as moving up in her career." And that person is still doing laboratory sales to this day, has a great career, and still friends with her, and I couldn't be prouder of her. So,
Mhm. What a great story. That's wonderful, Andrew. One of the things I've seen is companies hiring managers have a list, and it's very
mhm.
specific. They want 10, 20 qualities on a list,
Yes,
and
they do.
and they're trying to match it up exactly. And they might even get, let's say it's 10, and there's somebody that has 8, but they're missing 2, and sometimes they don't wanna move forward, but it really comes down to people make it too hard, I think. Do they fit into the culture of the
Hmm.
organization? Can they work with the hiring manager? Can they work with the team? Do they have the work ethic, responsibility, learning, teaching trainable? And are they excited? Am I
Yeah.
missing anything?
No, I think those should be, and again, my opinion, those should be the drivers.
Mhm,
And I think from some of the job descriptions I've seen as of late, they are unicorn hunting because you have to have some, they're getting very, very, very specific. And I think that can create some opportunities to have some fantastic candidates to be missed.
mhm, mhm. Yeah, I've seen that too. When you've got somebody who's got the drive, even the history and the skill set, and they're proven, but they may not be exact of what they think they're looking for. I agree with you. So, thank you for sharing that. I love
You're
the
welcome.
fact that you have had some great hires, but again, sometimes it comes down to personality fit, and common sense.
Yes, very much so.
We've gotten a little bit too complicated through the years, on assessments and tools and processes and things, and, um, sometimes
Well, and it's funny too, hiring when you find someone that you really feel is going to be a good fit and can learn and checks most of your boxes and is someone you're excited about. I also think too you have to move quick because
eh,
you don't want to linger because if you take too long, you'll miss the opportunity at the
yeah,
same time.
yeah, yeah, you'll miss the candidate, they've moved on to something else. True,
Yes.
they have, and then, of course, there's the opportunity cost lost if it's an open position and you don't have
Yes.
somebody in there. So, companies hold off on their hiring or finding the right candidate, and then the position goes unfilled. So there's an opportunity there too. So on the flip side of that, how have you been successful at retaining your people?
One of the best ways that, well, there's a few different ways that I think I've been successful about retaining people who work with me as coworkers, colleagues, what have you. One is open communication.
Mhm.
And to further explain that is creating an environment to where if you're sitting down with your team, there's always a get to know you period where everyone is very kind of, uh, polite and formal and everything's good. And there, which is fine, but very early on in the process, especially as a new leader, I like to tell my team, direct reports, however you want people who report to me, just kind of across the board. There are going to be times where we don't see eye to eye. That's okay. We can disagree. I need to hear if you disagree. My experience has been because someone's had the been given the permission to have a different point of view and we can discuss it, better ideas have come about. And I think that's very important as a leader that you give your team that knowledge, that ability, that permission to have that conversation with you
Mhm.
to further what it is you're working on. And I believe also that further cements your relationship with those individuals as well, that you are going to listen, you will take other points of view into consideration, and you will have a conversation. You're not in an ivory tower. You're there to not only serve the patient, serve the hospital, serve the community, but you're also there to serve them as what I like to call functional experts in their field as well. And as a leader, you depend on those individuals very much. I have, and that is one of the ways that I have. I think the best way to help retain people uh, throughout my time in leadership.
That's great. Thank you. Thank you very much for sharing that. Well, and healthcare is changing so quickly.
Yes,
It's been changing, and the rapid change of change is changing.
yes,
It's hard to keep up over these we thought maybe even a couple decades ago it was changing, now it's really changing
oh
on how
yeah,
care is delivered. There's certainly gonna be some shifts too in jobs and people, as well. I mean, where do you see from your perspective and it's a great perspective having all the different types of levels and roles you've had. Where do you see opportunities for folks that wanna move into those senior leadership spots? I guess, where are we headed, and where do you see some growth opportunities for candidates?
well, first, what I always tell people who want to start looking at progressing in their career or maybe getting into healthcare or going into leadership, if you're in that role already and you want to take on additional responsibilities, have conversations with people that you know where you work to say, hey, I am interested in this. And that's having someone who is more of an advocate for you where you work versus having a mentor. And they're two very different things,
Yeah.
which I always like to point out to people. So if you've had conversations with your COO, for example, say, hey, I'm very interested in learning how surgical services works or intake or supply chain. Are there opportunities where I could actually learn, listen, or shadow, attend some meetings to see if this is what I want to do and take it from there? Because also, as a leader, you want to do succession planning as well.
Yeah.
So there's that. But I think also where it's going to is we've all heard about AI in healthcare and every other industry, and I think there's a lot of uncertainty around it. I think it's going to be a good thing. I believe that it is very similar to when there was the big EMR craze 15, 20 years ago when EMRs came into existence. And there was a scramble and there was meaningful use, and there was a lot of putting the cart before the horse during that time. And I think we're in a very similar situation. I believe it's going to be a great tool. My point is, if there's opportunities right now for individuals who are leaning towards technology and want to learn about healthcare and have a knack for that, AI might be a very good space for you to be in. The very similar thing happened with telemedicine no more than maybe 12 years ago as well. That was something that came out, and the pandemic really helped us get hyper focused on how to deploy, which was a good thing because we were able to help and serve and take care of more people. And I think the same thing will happen with AI. I don't think we're to a point right now, and I could be wrong, where I don't think AI is going to diagnose individuals solo in this lifetime, because I think there's way too many nuances right now. But what it is going to require is people who understand it and can use it as a tool. And it's going to require people who can create the guardrails and the governance and the compliance and all the pieces that go into when we have a new advancement in a healthcare space. So that's where I see as the biggest opportunity is going to be. And I also think too, don't don't put your hands up and say this isn't for me, because I think that is, as anyone who is in the industry, I think that's a mistake of what you can do. I think being versatile and showing that you can learn and you can have a knack for learning this, which is going to be, I think, an amazing resource. But there's going to be a lot that goes into it too, and I think it's going to take a lot of individuals who understand how to make this work with processes and concepts that we have in place already.
Yeah, very well stated. I love the fact that you reference when EMR came out. And
Uh,
even, for even non-healthcare people going back even further into, Y2K, the
oh
sky
yeah.
is falling, the sky is falling, everything's gonna, like, stop.
Well,
Fear.
it's funny too when you also look at the EMR push, right? There were literally, we'll say, maybe 40 different EMR systems on the market. And I think maybe we're down to four now that are really well recognized and used consistently across the board. So I think you're going to have that consolidation on the AI side too,
Mhm.
which, it's just part of the evolution. So I think we're just at the cusp
Yeah.
of what's going to happen.
Yeah, I concur. Yeah, I concur too. So we're gonna need more and more people who understand how to use AI,
Hmm.
program AI. So basically, the job market, skill market is shifting. That's all.
It is, and this is just my opinion. I don't think it's going to run people out of the healthcare industry, but I also say that with a degree of caution. I think if you refuse to use it, it could create some obstacles for folks who are in the leadership.
Yeah. Yeah, well stated. Thank you very much. Well, I wanna just kinda give you a little bit of an option here on the floor because you have such an amazing background, truly.
Oh, thank you.
From, learning things, you are just a really great example that hard work, dedication, focus, and being able and the desire to learn something new has really evolved you into a leader, but it also you're very approachable, you're systemic in your thinking, yourself and in your team and organization and in the community. And it's all very interconnected, and more people need to kind of look at how people work together, how department
Hmm.
work together, how a hospital system, surgery center, whatever it is, really is part of that community. To really just kinda you're there there to serve people, for profit or not for profit. It's there about helping take care of people
Yes.
and having folks be able to live their best life, whatever the care modality is, whatever that is, preventative care to chronic care, serious illnesses, whatever it is. What advice do you give, let's just say, other leaders, other healthcare leaders that might be listening to our podcast today?
There's a couple different pieces. One, and this is just me. I believe that as a leader, being very deliberate and transparent in what needs to be done across the board, because there things can happen quickly in a healthcare setting, whether you're clinical or non-clinical, but we're all there to serve at the end of the day. I think having very deliberate and focused conversations around future direction, not only of the hospital, but if you are a department head, a VP, or a CEO, especially a CEO. I mean, I equate that to almost being the captain of a aircraft carrier. If you sit in the seat, you're responsible for everything that happens.
Okay.
And if you're not aware of something and someone asks you, the 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 statement "I don't know" doesn't sit well. So I really believe that having very deliberate, transparent conversations is paramount as a leader. And that's something that I still continue to work on to this day. Uh, you want to, it's much like networking. The more you do it, the easier it gets. So you have to practice. The second bit of advice I would give to other leaders is if you have an employee who wants to progress in their career, I think you need to support that in any way that you can.
Mhm.
Good people are really hard to find. And I think sometimes, and I've been guilty of this from time to time as well, where you're looking at the org chart and well,
Mhm.
there's not this. How do we do that? I think if you have a high performer and you have somebody who has long-term goals and they like the organization and they're a good fit culturally, you need to do anything to keep them because good talent will leave.
Yeah. True.
And third, and this is just across the board, and it's not so much for executives, but I think it's for anybody who is in a leadership position or aspires to be in one or wants to advance in their career. At the end of the day, you are ultimately responsible for your career. It's not going to be up to others. They can help you with your goals and to recognize that. But at the end of the day, you have to be your biggest advocate for what you want to accomplish too. So it's all a balancing act, and those are the three biggest pieces of advice I think I could probably throw out right now for folks who are listening.
I think those are great, Andrew. They're wonderful, they're valuable, whether you're a healthcare leader, whether that you're an individual who is growing in your career. There's definitely nuggets of knowledge here that somebody
Yes,
can take, right? There's wonderful little nuggets for different folks here. And I'm just so grateful for you to share your history, some suggestions on career, on hiring, on retention, on leadership, and also growth for folks today. I'm just very
yes.
grateful for your time. I've
Well,
known
thank you.
you a long time, and it's been a pleasure to watch your career growth, the momentum, and truly that you really care about folks that work with you and also the stakeholders in the community too.
Absolutely. There are many different facets of being a leader, and as I've progressed, I've realized that more and more is that you have your internal customers, you have your external customers, and there's just doesn't stop with the patients when you're thinking of your external customers. There's a variety of so uh, being approachable, being flexible, being able to elicit, maybe get some feedback that isn't what you were expecting, but being able to learn from that and rebound. They're all the things that as you get exposure and to those things, will make you a better leader at the end of the day.
Mm, absolutely. Well, again, thank you very much. This is
You're welcome.
Andrew. Pamela, this is our podcast, Healthcare Leaders Reshaping Healthcare. And we just trust that it gives people some nuggets of wisdom in their career, nuggets of wisdom on things they might be able to integrate in healthcare as we're all working towards, making healthcare better.
It'll take a team, that's for sure.
Definitely will. Thanks, everyone. Until next time.
Thank you, Pamela.